Wallace, welcome, welcome. Sorry, there was a maybe confusion or bad link. So I just a minute, Professor Tyler.
Yes, that's fine.
And so nice of you that it is very late night from Athens, Georgia, Athens. I think you are from Georgia, Athens. Is it?
That is correct. Yes, from Athens, Georgia.
Okay, just a few moments. I just wanted to give you a brief of Professor Tyler Wallace. He was moving from pilot to practice. He was a pilot. He was a pilot, and also we see Professor Chancellor Abu Bakr Hanif, Washington University of Science and Technology. Also, we are starting with Professor Tyler. Tyler is a PhD. Is a leader in AI training and adoption strategies across healthcare, government, and business. He previously served as a senior advisor at USAID and held a director level role of MD Anderson Cancer Center. Professor Wallace is a part-time faculty member of the University of Georgia of Public Health. Please, Professor Tyler Wallace, for your short speech, keynote speech, please.
Perfect. Thank you. Thank you, everyone. I hope you can hear me. If you can't, please say something and I will adjust my microphone accordingly. It's nice to meet all of you.
Yeah, I hear you, but the sound is low.
The sound is low. I will adjust my sound. Let me see. Is this better?
It's okay. It's okay.
Microphone check. 1, 2. 1, 2. This is as loud as I can go on my end. I'll speak louder. How's that?
Yeah, it's fine. It's fine. Thank you. Please.
Well, thank you. Thank you so much for having me. It is a pleasure to be here and to talk to you all the way from Athens, Georgia.
Oh,
so
that is just a minute. We are some technical issues. Maybe sound is not clear. It is coming here, but our board is smart board sound is okay. Then it is listening here from there or from here. Okay. Okay, please. Okay, please continue, please.
Perfect. I'm happy to do that. And let me know, again, I'm happy to adjust on my end. Again, very happy to be here and thank you for the opportunity. And so what I'm going to talk about is you're learning a lot about technology. I want to talk about how to implement that technology, because if that technology, if we have it, but we don't implement it, then it doesn't do any good. And so what I'm looking at is how do we implement particularly artificial intelligence in rural hospitals in the United States. And so these are organizations that have the most to benefit from artificial intelligence, but they have the fewest resources in order to make that happen. So I put a few interventions in place, and I want to talk about that, and then we can go from there. So my name is Tyler Wallace. I was working with the United States Agency for International Development. And so I was doing training all around the world up until March of this year when USAID was shut down. And so I have done over 50 workshops related to AI training and adoption with over 1,500 people having gone through one of my training. I now own an AI adoption consulting company where we focus on strategy, implementation, and training. And so did that first at the federal level and now do that at the healthcare level, as well as government and academia and small businesses. And as you aptly stated, that I am a part-time faculty member at the University of Georgia. A few things. These are my own views, not the University of Georgia's. These are my own opinions. And then I do occasionally work with Microsoft on their AI platform. And so I will talk about, I don't even think it'll come up, but I just have to get that out in a disclaimer. So we're going to talk about a few things. One is, what does rural healthcare look like in America, and why is that a problem for technology adoption? Then we'll look at some of the issues that we have with AI adoption, and then some of the solutions that we have put in place, and maybe that will apply to your setting as well. I hope so. So the United States healthcare system is one of the most fragmented healthcare systems in the world. Just before this call, I asked ChatGPT who has a more complicated healthcare system than the United States, and ChatGPT said no one. The United States is the winner. And so this is what we are working with in the healthcare system. And I work with hospitals to make sure that they get paid. So when a patient goes to a hospital, the government doesn't automatically pay that hospital, and the insurance company doesn't automatically pay that hospital. And so what I do is work with hospitals to say, hey, how do you get reimbursed for those services? And I'll show you a little bit about what that looks like. And so in rural hospitals in America, they provide services and care to about 46 million people, or about 1/6 of our entire population lives in rural areas. So outside of the city in rural America. And you can see here's kind of a map of how they are spread out across the country. And in our country is that the rural population, so the folks that live outside of cities, their health is substantially worse than those that live in cities. And so rural Americans will live 2.5 years less on average than those that live in urban areas. Looking at physicians, there's about 31.2 physicians per 10,000 population in urban areas. In rural areas, that's about 13.1 physicians. So you're missing about a ratio of 2.5 physicians, 2.5 times fewer physicians in rural areas. And heart disease, rural patients have a 40% higher likelihood of developing heart disease. We have rural hospital closures in the United States. And if the rural hospital can't keep enough business and can't keep money coming in, that rural hospital will close. And we have had about 180 of those in the past 15 years. And then also we have an issue with broadband in rural areas. So about 25% of individuals in those communities have broadband speeds less than 25 megabytes per second. And so we just have a number of issues affecting rural health in America. One of the biggest issues we have right now is that insurance does not want to pay for the services provided to hospitals. And so patients in the United States, they pay money into an insurance company, and then that insurance company pays the hospital. But if the insurance companies, if they don't pay the hospitals, then they can make more money as profit, right? And so there's an issue that a lot of these insurance companies don't want to pay all that these hospitals are due. And we know that insurance companies are now using artificial intelligence to help them deny payments to hospitals. And usually this was just in insurance, but now our government, the United States government, is starting to use artificial intelligence to determine in certain procedures and in certain states what hospitals get reimbursed for what services. And so this is new. And so we've got the people who pay the money to the hospital, they are using artificial intelligence, in order to limit the amount of money going to the hospital. And right now, our hospitals don't have anything to combat that. And so, what I am doing and what some others are doing is getting hospitals ready to adopt artificial intelligence tools. And one of the use cases that we can do is using AI to make sure that the hospitals are getting reimbursed what they should be getting reimbursed. But we have a problem in rural hospitals. We have an adoption problem. We have a number of issues that are plaguing these rural hospitals. The first one is just the internet build out and the wireless build out. So again, getting fast internet speeds to these areas is tough. Making sure that there's wireless throughout the whole hospital is difficult as well. Also, our EHR systems, our electronic health records, are very old and they don't talk to each other. There's not a lot of interoperability between systems. So that is something that we have to work with. And then these rural hospitals, they don't have a lot of money to work with to bring in new systems. And then we have compliance issues. We have something called HIPAA, and that is a law or a regulation that we can't, that makes it difficult for hospitals to share information. And then staffing, having the knowledge to implement some of these artificial intelligence tools just doesn't exist at these rural hospitals. So we developed, my company, as well as working with another hospital association, we developed a couple of solutions to get hospitals on board, to get ready for what's coming with artificial intelligence, because right now they have nothing. And so we've got to really lay the foundation or lay the framework to say, okay, here is what you need to have in place in order to bring in some of the technology that is going to be most beneficial for you. So I developed two things. One is I developed a certification just for rural hospitals, for individuals who want to learn about AI, to get familiar with it. There is now a certification for them. And the second thing I developed is a cohort-based AI readiness program where we take a group of hospitals through a 12-week training program to lay the foundation to have them ready for artificial intelligence. And I'll do a deep dive into each of those, and then I'll answer questions if you have them. If not, I will hand it over to Dr. Hayter. So this AI certification, it's the first certification in the United States, and it is currently the only certification in the United States for rural hospital practitioners. And so if you're a professional in a rural hospital, you can go through this certification. If you're a leader in a rural hospital, I put together a 9-course certification to focus on AI literacy and AI safety. Right? We want to make sure that hospitals are doing that. We want to make sure they have the basic foundation of AI concepts and terminology. And we want to make sure that they know how to use artificial intelligence in a safe way. So we talk about biases in the training data. We talk about hallucinations. We talk about security and safety and prompt injection hacking, right? So we cover all of that in this program. And so that is for individuals in rural areas who say, I really want to learn more about AI. Now they have a program for them for that to happen. And that did not exist up until this summer. And so this is something else we put together, was this AI readiness program. And it is a 12-week cohort-based program that focuses on laying an AI foundation. So how do you take a hospital that is still using a fax machine, that is still using paper for a lot of their processes? How do we even start getting them off of those processes to start using something like artificial intelligence? And so that's what this program does. I'm a big believer in cohorts. I've done several cohort programs like this before, and it works really well. So if you take a group of people or a group of organizations and you have a certain end in mind, it is wonderful to take that whole group through a process to get them to an endpoint. Your professors do this. If there's a professor in the classroom, or if you're a student, you are a cohort for a particular class where you start the semester and then you go through with all of your peers to the end of the semester where everyone has learned everything that was supposed to be covered for the semester. Well, we did that same thing, but for rural hospitals to say, hey, here is what rural hospitals need in order to succeed in this environment. And then taking not just individuals, but whole organizations through that process. So what makes these cohorts valuable is that we have a peer-based learning. And so they're learning from me, the instructor. They're also learning from each other because they're addressing issues as they come up. And so if we're rolling out an AI policy at these hospitals, one hospital might have a question about the AI policy. I bet another hospital is going to have that same question as well. And so we can have that dialogue and that conversation. They're learning from me and they're learning from each other. Plus, we can deliver just-in-time training. So if we're going to talk about AI policies are a great thing. I will give a lecture on AI policies. I will give them templates for AI policies, and they will go to their leadership in the organization. They will take their learning, they will take the templates, and they will craft their own AI policy based on what they learned and what templates are available to them. And now they have their own policy, and you have to have a policy in place and a governance committee in place before you can start rolling out AI tools. And then I provide coaching and training or coaching and consulting for them. So if they have questions, they can reach out to me at any time and I can give them access to my resources. Something we do is that we make sure every site, every hospital has an AI lead as well as a backup. And this person gets the certification. So they get the certification in rural health practitioner AI. They're responsible for managing this initiative at their hospital. So we really want to build up these people and invest in them because after the program is over, after the 12 weeks ends, we want that person to be left behind and to carry the work forward. So we invest a lot in our AI leads because they are the ones that are going to be making this happen at these rural hospitals. So this is really small. You can't see the font. I apologize if you're in the back of the room. But here are some of the topics that we cover in our cohort program. So we start with AI safety, again, looking at AI security, training, policies. Then we talk about the data setup and the tech setup that's needed to again, lay the foundation for AI. We look at change management. So how do they communicate that AI is coming to their organization? Right? In the United States, our economy is not doing great. And so there's a lot of talk and speculation that artificial intelligence is taking jobs. And so we want to communicate to our rural hospitals that their jobs are going to be safe for the time being, right? So we want to make that clear. And then we get into some LLM prompting and use cases. And then we start talking about some advanced AI tools like agentic AI, as well as some advanced Microsoft features like the Azure environment and Power Platform. And so that is our 12-week program. Again, going from zero, having nothing, to say, hey, here is an AI environment in Microsoft where you can roll out some of these tools. And then I sell my consulting services. My consulting services are bundled into this cohort program where I can do executive training for their leadership team. I can look at their AI policies. We can look at AI strategy, et cetera, et cetera. And so I'm available to be a resource to help them. So what's the outcome of this program? Is that once the hospital goes through this cohort program, they are now ready for more advanced AI. And so whether that is AI in the clinical space, AI in what's called the revenue cycle, AI with scheduling patients or any of that, they're now ready for it because we've laid the foundation. And staff get more comfortable with AI because if you're not in it all the time, AI seems very daunting. And so we want to remove some of that AI anxiety from the staff and make them feel very comfortable and confident in artificial intelligence. And then these hospitals take a more proactive posture in adopting AI because in the past, they're very responsive and they're very scared because all of this talk about AI, and they don't know where to begin. But after they go through this program, they're like, okay, I'm confident. I know that AI is a tool that can help me, and I can determine where I want to put those AI resources. And AI is going to work for me. I'm not going to be scared of it. And we have seen this through hospitals going through our program. So in summary, rural hospitals have the most to gain from AI, yet they have the most challenges to implement that. And the best model that we have found is to put these hospitals in cohorts and walk them through a program like this in order to prepare them for what is coming. So with that, thank you for letting me present. My name is Tyler. If you have any questions, I'm happy to answer those. And if not, I can hand this over to the next speaker. So thank you.
Please, any questions? And it's very important for especially our faculty, artificial intelligence. You see, sorry, it is very important that for our faculty, especially artificial intelligence, we can work with medical school, Samarkand State, Medical State University, and hospitals, private, public. So there are many scopes for our students, researchers to work with the medical because it is a new area, medical. We need to help all professions. So Professor Tyler Wallace, it is a fantastic job, and we wanted you to visit us at Samarkand. And Professor Mahmoud Khan told me that you may visit. So we'll work together with you and our faculty. Maybe this course will communicate with you and Professor Mahmoud Khan regarding future work together.
That would be wonderful. Thank you.
And looking forward to see you in Samarkand.
Thank you very much.
Thank you. Thank you. Thank you.